Hi everybody. I guess I have to do this lecture again because the original one did not have any volume. So we're redoing this. I apologize for my voice again. I'm dealing with laryngitis, so this is the best I can do right now. So we're gonna focus on endocrine system lecture today. Our goal is to look at some of the main organs and see how these organs contribute in production of the hormones and what they actually accomplish in our body. We will go into more detail if you take physiology, where we're focusing more on hypersecretion of these hormones and also the mechanism they use to transfer through the blood. I apologize. So endocrine system is responsible for production of hormones. It is important to understand that when we're talking about, sorry, let me just switch my slide so you guys can see my screen. So they produce hormones. Their function is very similar to the nervous system in terms of controlling and coordinating body activities. They help for maintaining our homeostasis, controlling our growth, and also dealing with a lot of our blood chemistry, such as the level of calcium, glucose, potassium, etc. And now it is important to understand that the endocrine system is not as fast as our nervous system, since it doesn't rely on the electrical impulses. Rather, it relies on a ductless system where the hormones basically get released directly into the bloodstream and then gets transferred to the target tissue. And because of that, it is a slower. However, its effects does take longer, so it's more persistent. When we look at our endocrine glands, there are two types of glands. There are ones that are considered to be pure, which implies that they're only associated with the endocrine system, and they're the ones that are sharing functions with other organs. For instance, pancreas is part of our digestive system and endocrine system. Thymus is part of our immune system as well as the endocrine system. Gonads are basically reproductive system like ovaries and testes. And then you have hypothalamus, which is part of the nervous system. And lastly, kidney, which is not something I'll talk about, but it is part of our renal system or urinary system. Again, because they need to be directly transferring these hormones into the blood, they're going to be highly vascularized. Now, we use three mechanisms to stimulate the release of hormones, and they are known as humoral, neural, and hormonal. I'm going to show you this on an image. I think it's a little bit easier. Humoral simply means that you look at a concentration of a specific molecule or particle in your bloodstream, and if you notice that those levels are low, then your endocrine gland releases a hormone to deal with the low or high concentration of a specific ion. For instance, in this case, you can see these little orange dots on the surface of your thyroid gland. These little dots are your parathyroid gland, and they're basically monitoring calcium level. And when calcium level is low, it releases the hormone PTH, which elevates the calcium level in your bloodstream. So again, the gland is monitoring and then consequently releasing the hormone to return things to balance. The second type is neural. Neural is also pretty self-explanatory. And since we're talking about neural, it means there is an involvement of your nervous system. In this case, we can see a cross-section of your spinal cord. There is a nerve that extends into your adrenal medulla, which is the central piece of the adrenal gland, and causes a release of your two main hormones called epinephrine and norepinephrine. And these are basically the ones that are going to trigger your sympathetic nervous system, the fight or flight response in your body, the ones that are going to make your heart beat faster, increase your respiration, slow down your digestive system, etc. So again, involvement of nervous system is important here. And the last one, as the name implies, hormonal stimulation simply means that one hormone control the release of another hormone for a secondary gland. For instance, on the image you see right here, this is a gland as of the endocrine system releasing its own hormone, and the hormone from this gland, which is your anterior pituitary gland, goes and affects other glands, allowing them to secrete their hormones. So this is called a tropic hormone, as in one hormone affecting another hormone. But again, hormonal simply means release of one hormone controls the release of a secondary hormone. The next thing that I want to kind of briefly mention, again, we're not going to go into detail about the actual process in detail, but I do want you guys to know that we do have two types of hormones, and based on them, they do take different action, which triggers basically the final effect. We have hormones that are cholesterol-based, and these are basically called steroid hormones. Because they're fat-based or lipid-based, they can go directly into your nucleus and affect or target your DNA. So it's a more direct interaction with the cell. Versus if you're talking about the non-steroid hormones, these are protein-based, either a peptide or an amine or a full-size protein. Because of their characteristics, they're not lipid-based. They don't get easily access to the inside of the cell and inside the nucleus. So they use what we described here as a secondary messenger system, which is kind of like you're passing the message from one protein to another, to another, to another, and eventually that message is going to get inside the cell. So right here, you can kind of follow the arrows, and again, the final reaction right here lead to a response in your target cell. There's some of the examples of these hormones listed here. Now, again, we already kind of looked at the main list of these endocrine glands or endocrine organs, but here is it in terms of location. We have right here behind your thalamus, we have your pineal gland. Right here, we have our hypothalamus, which is that little triangle. And hanging from that, you have your pituitary gland. Going further down into your neck, you have your thyroid gland, which is this butterfly-shaped gland with spots that depict your parathyroid gland on its surface. Going down, right superior to your heart, so your heart would be sitting right here. So superior to your heart, you have your thymus, which is part of your immune system. In your abdominal cavity, you have your kidneys and your adrenal gland. And then tucked in behind your stomach, you have your pancreas, which is again part of the digestive as well as endocrine system. And lastly, in the pelvic region, we have our gonads. Depending on the gender, it would be either ovaries or the testes. Now we're going to start by looking at our pituitary gland. So pituitary gland is this tiny gland. It has two sections, a front portion and a back. So they're referred to as anterior lobe or posterior lobe, or anterior pituitary gland and then posterior pituitary gland. They sit in this little cavity inside your skull called the sella turcica, which I think something we learn about in your skeletal system lab. Now, this is an essential piece of information, guys. Anterior pituitary gland makes its own hormones, and we'll go through those hormones in just a minute. So any hormones that is released from your anterior pituitary gland is indeed produced by anterior pituitary gland. However, the release of those hormones are under the control of your hypothalamus. So they will not be released until your hypothalamus sends a signal to the anterior pituitary gland and allowing those hormones to be released. Now, those signals can also be inhibiting signals. So if hypothalamus sends what we call a releasing hormone, that encourages the anterior pituitary gland to release a hormone. However, if hypothalamus is sending what we call an inhibiting hormone, it prevents the anterior pituitary gland from releasing any hormone. So it's kind of like a stimulation versus inhibition. So hypothalamus can stimulate the anterior to release, or it could inhibit the release of its hormones. Here's a pathway that your hypothalamus uses to access the anterior pituitary gland. I don't need you guys to know all the detail listed here. What I do want you guys to understand is that hypothalamus has these little extensions of the nerves that open to this portal system. And this portal system are basically these capillary of networks that allow communication with the anterior pituitary gland. And again, either cause it to release hormone or it prevents it from releasing a hormone. So what are the main hormones of the anterior pituitary gland? So these are the main hormones. We have what we call a growth hormone, or GH. These are, as the name implies, are going to be essential for the growth of the individual and the maintaining of that individual. Prolactin, you might have heard of it, is associated with lactation or milk production. Thyroid stimulating hormone, or TSH, is going to target your thyroid gland, a butterfly gland on the throat, to release its hormone. Adrenocorticotropic hormone, or ACTH, basically going to target your adrenal gland and allow it to secrete its hormone. And then the last two, which is follicle stimulating hormone, or FSH, and luteinizing hormone, or LH, are going to be targeting the gonads in both male and female. So again, either testes or the ovaries, and cause the production of either the sex hormone like testosterone, estrogen, progesterone, and also production of the sex cells that are basically the oocyte as well as the sperm. So we will basically expand on this in just a minute. This is a really good image. I'm not going to kind of go over it. You're welcome to review it. It's just kind of showing you the actions of not only the anterior pituitary gland, but also the posterior pituitary gland. But I like to discuss them one at a time. But again, if you guys want to kind of review the whole system, you can come back to this slide after you've finished everything about the pituitary gland as a whole. So as I mentioned, one of the first hormones produced by the anterior pituitary gland is the growth hormone. So as the name implies, basically going to be a hormone that's associated with the growth of the individual. Now again, remember that the hormone is produced by anterior pituitary gland, but the release of the hormone is under the control of your hypothalamus. Now, growth hormone, as you can see in this picture, is going to target your fat tissue or your adipose tissue. It's going to target your bones, and it's going to target your muscles. And how does this growth hormone affect you? First of all, it's going to help you break down your fat and basically use that fat as a source of energy. So it's helped with the metabolism of the fat and using that as a source of energy. It targets your bone to basically allow you to grow your bone, which is, again, really a good thing. And again, last thing is, if you're undergoing growth, you want to have larger muscles to basically match the size of your bones. So there's an increase on your muscle mass. And again, this is going to be more significant if you're looking at typically a male versus a female, but the changes are going to be similar when growth hormone is present. Now, what if I have a significant, I apologize. What if I have a significant increase in the amount of the growth hormone during childhood? So if that happens, we call that hypersecretion. Hyper means elevated or increase or above normal. Sorry, guys. And that typically leads to gigantism in children. It could be a result of a tumor on the surface of the anterior pituitary gland. I apologize. I'm going to stop the recording for just a second and come back. Again, if you have an increase in this hormone in children, it's called gigantism. And this hormone can also be elevated if you're already adult. So you have already grown your normal size, and now you have an elevated levels of growth hormone. In such a case, then you will have what we call acromegaly. So acromegaly happens in adults, and literally, as you notice, the changes in that individual here from age of 16 to age of 52, that this is an abnormal growth, but only affects the specific parts of the body, like your hand, feet, and face. So there is abnormality on those regions. Now, if you don't have enough of that hormone, we call that hyposecretion, and that results in what we call dwarfism. And this is basically the picture of the shortest person versus the longest person. I don't know if this is the most updated picture, but this is what was posted in your textbook. I think the tall gentleman is above 7 foot tall. Now, the second hormone we talked about is thyroid stimulating hormone. So if you kind of look at the picture again, you have the anterior pituitary gland can release the thyroid stimulating hormone. But the release of this hormone depends on the hypothalamus sending a signal, which is TRH, to the anterior pituitary gland to release TSH. Now, TSH needs to go somewhere, right? As the name implies, thyroid stimulating hormone, which means that this hormone is going to be encouraging the thyroid gland, which is this butterfly-shaped gland we talked about earlier, to produce thyroid hormone, which is T3 and T4. You can just bundle these together and say this is your TH hormones, basically, or thyroid hormones. So again, there's 3 steps: hypothalamus signaling the thyroid, signaling the anterior pituitary gland, which that in turn signals the thyroid gland. Now we also have the 2 hormones that are targeting the reproductive organs: follicle stimulating hormone, or FSH, again, produced and released by the anterior pituitary gland, but this is happening under the control of hypothalamus. Then, how does it affect our female? So again, the effect is going to be different in male and female because the goal of the reproductive system is different. It's either producing the sex hormones specific to the genders or producing a mature egg or mature sperm. So in FSH, the female are going to be stimulating the production and carrying out a process called ovarian cycle, where a follicle is matured, and within that follicle, you basically have an egg. So basically, by maturing your follicle, you're maturing an egg. It also produces one of the most important sex hormones for female, which is estrogen. Now, if in female, it helps you develop an egg, so in turn, in male, it should be stimulating the production of their sex hormone, which is the sperm. Now, as you kind of can imagine, hyposecretion of these 2 hormones, so if you have low levels, hyposecretion of them, is going to have major effect on the maturation, sexual maturation of that individual. It's either male or female. So they will not be able to produce the proper egg number or release an egg or mature an egg, or in case of male, they would have either no or very limited number of sperm. In terms of hypersecretion, as of right now, there is no major impact on the individuals who may have elevated amount of FSH. The second hormone we talked about is the luteinizing hormone. Again, luteinizing hormone, same thing, produced and released by the anterior pituitary gland under the control of your hypothalamus. Now, in female, it's going to trigger ovulation, which means the egg that you produced in a previous slide needs to be released from the ovary, and that release is referred to as ovulation. So you need to have an elevated amount of luteinizing hormone, or LH, that causes that release. It also includes, it also increases the production of a secondary sex hormone for females called progesterone. And this progesterone is really important because it's going to encourage the pregnancy of that individual. So it's building of and preparing more specifically the uterus for a possible pregnancy. Now in male, if it's females, is to stimulate the production of progesterone. In male is also going to do similar effect, which means production of its sex hormone, which is the testosterone. Now, just like FSH, hypersecretion of this hormone will not have a significant effect on us. However, if you have hyposecretion, if you have low levels of LH, you basically are producing very little to no progesterone and testosterone, which means you are failing to sexually mature as an individual. Not you per se, but person. We have prolactin, another hormone. Again, as the name implies, it's associated with lactation. This is targeting the mammary tissue, which is breast tissue, and it's stimulating the development and production of the breast tissue and production of the milk during pregnancy and after childbirth. As of right now, there is no specific function produced or associated with the male body, but that doesn't mean that it doesn't do anything for them. Hypersecretion in female, of course, is going to have an effect called galactorrhea, which means a significant increase in milk production. However, if you do have elevation of this hormone in male, it triggers impotency because, again, it's not supposed to be elevated in male, so it does have a negative impact on the male sexual maturation. Hyposecretion of it is, of course, again, in female, would be milk production would be decreased during nursing. And nowadays, there's so many herbal medicine and cookies and I don't know, all the other stuff that goes with it that encourages consumption of these herbal drinks and food that will help you increase your milk production. I'm not going to expand on that. I'm not a big fan of it. I'm not a big fan of introducing that into your milk, which eventually goes to your baby. But that's my personal opinion. So. Now, the posterior lobe. So we talked about the anterior. The posterior lobe of your pituitary gland is actually structurally part of your brain. It itself, the posterior pituitary gland, doesn't produce any hormones. What it does is the hormones that are produced by your hypothalamus are sent into the posterior pituitary gland to be stored in there. When your hypothalamus sees the need for those hormones to be released, then all it does is send a nerve impulse down into the posterior pituitary gland and causes the release of those hormones. But again, posterior pituitary gland itself is not producing any of those hormones. Now, there's only two hormones that are produced by the hypothalamus and is stored in the posterior pituitary gland. And these two hormones are antidiuretic hormone, or ADH, also known as vasopressin, and the oxytocin. So what are each of these hormones do? So antidiuretic hormone, as the name implies, antidiuretic, which means prevention of water loss. Diuretic as in diarrhea, water loss. So antidiuretic means preventing water loss. And this type of, this hormone specifically is highly active when you are super dehydrated, when your blood volume is low. And the antidiuretic hormones basically encourages the reabsorption of water back into your system. So you're not wasting any water in your urine. And that leads to you forming a very low volume, very concentrated urine. The second hormone, which is oxytocin, is again produced by the hypothalamus and stored and released by the posterior pituitary gland. In women, oxytocin is really important during childbirth because elevation in those hormones causes an increase in muscle contraction of the uterus, which basically pushes the baby out through the birth canal. Secondary role is that it initiates milk ejection during breastfeeding. So oxytocin level does stay high even after birth, especially if you are breastfeeding. In male and female, it does have a role in creating good, positive feeling when you're with your partner. These are the kind of feeling of trust and psychological stability. And again, this is what a lot of people refer to as love hormone or falling in love for somebody. Again, that's associated with the hormonal changes or elevation in oxytocin. Now moving forward, and now we're kind of working our way down this neck, where your thyroid and parathyroid gland are located. Now, if you guys look at this picture, the thyroid gland again is this butterfly-shaped gland right here. It sits right in front of the trachea, which is this tube right here. So it's kind of hugging your trachea. Thyroid gland produces two main hormones, which are T3 and T4. And these two hormones are categorically referred to as the thyroid hormone. Now, why do we care about these thyroid hormones? The metabolism of your body, the rate of growth, with the combination of the growth hormone in that sense, are associated with the thyroid hormone. So a lot of time when people have major changes in their metabolism, either slowing down or speeding up, one of the first tests your doctor would do is to test the levels of your thyroid hormone, thyroid stimulating hormone, and thyroid releasing hormones. So these are something that can be measured in the blood, and they have to have a specific number. So what happens if you do have an elevation of the thyroid stimulating hormone? What if you do have a hypersecretion, or what we call hyperthyroidism? So kind of think about your body is going into an overdrive. Everything is speed up. You're going to have a rapid or irregular heartbeat, which is called tachycardia. Because your body is burning through so much fat, because your metabolism is sped up, you are going to have loss of muscle mass, or what we call muscle wasting. Your weight is going to, of course, decrease. Because your metabolism is sped up, you are going to have an increase in appetite. Your nervous system goes into overdrive, so you kind of have that jittery feeling, nervousness. Your eyes are going to be bulging out. That's one of the common symptoms of it. Your face is usually flushed because, again, that increased metabolism means extra heat. And then many people also have diarrhea because, again, the activity of the digestive system has increased, which means your body is not absorbing a lot of water. Now, the best way to treat this is to give what we call anti-thyroid medication or radioactive iodine, which is basically slow down the production of the thyroid hormone. So in either of these cases, again, in the case of hyperthyroidism, the goal is to slow down the process so the person basically can return everything back to normal level. Now, what if you have what we call hyposecretion, hypothyroidism, as in you don't have enough thyroid hormone in your system? So all of the actions that I've described before is going to be reversed. So your metabolism is going to slow down, which means you're going to gain weight. You won't have an appetite. Because of the slow metabolism, you're going to feel cold all the time. You're going to be constipated. Again, that weight gain is going to be there. Nervous system is not going to be very effective. So mental impairment, depression, hair loss. So everything basically is slowed down, which means your body will not be able to maintain itself. If that happens again in an adult, it's called myxedemia. However, in children, that the damage is going to be more significant. It's a medical condition called cretinism, and typically associates with when the mother, while she was pregnant with the baby, did not have enough iodine in their diet. And it would lead into developmental delay for the child as well as retardation, which is very unfortunate. Now, if you're looking at a scenario where you have a medical condition called goiter, where you have this kind of an enlarged thyroid gland that's literally poking out on the anterior aspect of your neck. So this is related to iodine. or deficiency of iodine in a diet. And let me just clarify one thing. One of the most essential components of the thyroid hormone is iodine. So if you're lacking it in your diet, if you're pregnant, or if you're lacking it in your diet as an individual, then what happens is your body is unable to produce thyroid hormone. Because of that, your body is kind of trying to force itself, overwork the thyroid gland to produce the thyroid hormone. So that overworking of the thyroid gland causes us enlargement. So for these individuals, again, you really need to look back at their diet and see what's going on with their diet. Now, it was an issue in about 1920s, especially in Midwest, because they didn't have access to really rich sources of iodine, even like iodine-rich food or soil, so no seafood, and again, it wasn't present at high levels in their soil. So both of these led to development of significant number of goiter cases in the 1920s. Simple resolution, iodized salt, which is pretty much what we see on a typical supermarket shelf across the US. And again, it's a very simple solution to a major health issue or preventing a major health issue. Now, another hormone that is produced, I'm just going to backtrack here. Another hormone that's produced by your thyroid hormone is called calcitonin. Now, again, what I'm describing to you is very basic, guys, but the concept applies. When you have high level of calcium in your bloodstream, that increase in calcium level needs to be dealt with. So you want to return things back to homeostasis. And the way you do that is by releasing calcitonin from the thyroid gland. So if you have high levels of calcium, calcitonin gets released. And this calcitonin targets your bone, your intestines, and your kidneys. You don't need to know what it does to them, but it targets them. And again, the ultimate goal is to lower your calcium in your bloodstream. Now, what if I have low level of calcium? What if I haven't been taking calcium in my diet? How does your body deal with it? So we have calcium deposit in our body, and your body basically wants to tap into those. So one of the hormones that is produced by the parathyroid gland. Again, those little spots that you have behind the thyroid gland. So you have to look at it from the posterior view, as you can see here. So these parathyroid glands are basically, first of all, not the same numbers or same location in everybody. So they are different. However, they all going to do one thing, and that's basically helping you elevate the concentration of calcium in your bloodstream. And it does that by producing a hormone called parathyroid hormone. So parathyroid hormone, or PTH, is released from the parathyroid gland when your level of calcium is low. Again, it's going to still target bone, intestine, and kidneys. So same structures, but because it's PTH, not calcitonin, it's going to increase the blood calcium level. So it's literally having the opposite effect of calcitonin. And that's basically all you want to know. You don't, again, there are details on the page. They're good if you're learning about physiology, but for anatomy, just understand the basic. Low calcium level increases parathyroid hormone, which targets bone, intestines, and kidney, and consequently increases the calcium level. Now, pancreas. Pancreas is the gland that's actually on the left-hand side of your body, tucked in underneath your stomach. It is a tadpole organ. So if you guys go a couple of slides forward, here is the shape of your pancreas gland. And it's important to understand that pancreas is an organ that, again, works with both digestive system as an exocrine function. And then it also produces two essential hormones in terms of endocrine function. So in terms of endocrine functions, it produces by these little kind of bulky cells that are called islands of Langerhans. And you have two types of cells, alpha cells and beta cells. So alpha cells are going to be extremely important when your when your glucose level is low in the bloodstream. So let's say you've been fasting for hours. So alpha cells, which are the least frequent ones among these, they're the red cells, they're going to produce a hormone called glucagon. What is glucagon going to do? It's going to break down glycogen to glucose and basically raise your blood glucose. So if you're fasting, glucagon increases your blood glucose. But the opposite is going to be handled by your beta cells and production of insulin. So the purple cells you see are now going to be your beta cells, again, much more frequent. And these beta cells are going to be important in production of insulin. So when your blood glucose is elevated due to eating your food or doing any type of basically increase in your blood glucose is going to target the release of insulin, which literally lowers your blood glucose by taking that extra glucose and converting it to glycogen. So again, alpha and beta cells work opposite of each other. Now, whenever we talk about insulin, it's impossible for us not to talk about diabetes. So I'm going to briefly go over diabetes. Type 1 diabetes is also known as juvenile diabetes. It's usually activated or been present in an individual before they reach the age of 15, hence the name juvenile. It is an autoimmune disease, which means your own immune system is attacking your beta cells and do not allow the beta cells to produce insulin. And again, if you have no insulin, you can lower your blood glucose. These individuals with type 1 diabetes are going to be dependent on insulin for the rest of their life. Type 2 diabetes or adult onset diabetes are what we call insulin resistant diabetes. These are the type of diabetes where you have very bad eating habits, you eat a lot of fatty food, super sugary food, sugary drinks, you sit for a long period of time, no exercise, etc. So what happens is because of that continuous elevation of glucose in your bloodstream, your cells that are taking that glucose are becoming insensitive to insulin. They said, I'm just going to ignore insulin because you've been high continuously. So you really don't mean anything to me. So that insensitivity to insulin basically causes the blood glucose to remain elevated for a long period of time. Typically type 1-2 diabetes, these individuals are going to be dependent on insulin as well. So if you go on insulin injections, you won't come off of it unless you have gestational diabetes. And I'm not going to talk about that one. But again, you're just kind of giving the body a very high dose of, like as is shown here. Here's your pancreas. You're going to produce a huge amount of insulin that allows the organs like your liver, your muscles, or your fat tissue to take up that extra glucose. And this is really important because we want a scenario like this where very little insulin is going to accomplish the job in a healthy individual. Versus if you are insulin resistant and you're insulin dependent, you need huge amount of insulin in your bloodstream for the job to be accomplished. So be careful with your diet, basically. That's what I'm saying. Okay, now we're going to talk about the gland that sits on top of your kidney called the adrenal gland. Adrenal gland has two sections. The outer aspect of it is, which is right this part, is called the adrenal cortex and has three zones: zona granulosa, zona fasciculata, and zona reticularis. So granulosa, fasciculata, and then zona reticularis. And adrenal medulla is the central part And that one is literally part of the nervous system and is going to be releasing our norepinephrine and epinephrine. Again, the ones that are going to target our body and create what we call the fight or flight response. So let's take a look at each of these zones and say what they create. So first of all, let me just kind of go forward. So the first zone that we have is zona granulosa, the most superficial zone. This is going to be very important for when your blood volume is low. So kind of think about it, what ADH did, the antidiuretic hormone did for us. However, there is a difference. The hormone that gets released from zona granulosa, the most important one, is called aldosterone. And aldosterone is basically going to increase the reabsorption. So your body is going to take in a lot of salt, which is Na, and water is going to follow that. So Na and H2O go together. And then at the same time, when those two are being reabsorbed, you are going to be secreting a lot of potassium. So basically, you're going to take in sodium, Na, and getting rid of potassium, which is K. If you have a major, if you have, again, unbalanced aldosterone level, you can have major health issues because of how it controls the levels of sodium, potassium, and water. Now, the second zone, which was the largest of the three zones, is the zona fasciculata. This is going to be responsible for producing your steroid hormones, like your cortisol, the one that you get when you're like sick and you get those little steroid packs that you take like 6 one day, then 5, then 4, then 3, and 2, 1. So this is what your body naturally does. So when you're super stressed out or there's a major kind of a medical condition where your body needs to heal itself, you release a significant amount of cortisol in your bloodstream, which is going to help you break down fat, break down glucose, break down protein, which again, by promoting and providing a significant amount of energy for your body to make sure it has enough energy to heal itself. And think about this as a short remedy. It cannot be a long time because then these cortisol, these stress hormones, what we call them as stress hormones, cannot be in your body long term because then they're going to have a negative impact on you. So when we're talking about these benefits right here, these benefits are when you're basically dealing with a stressful situation and your body needs to deal with it. Now, the last zone that we have is zona reticularis, which is the closest one to the medulla, and it produces a group of hormones called androgens. Androgens are really important because they're precursors to your sex hormones, and these kind of sex hormones in male would be the testosterone and female would be estrogen. So if your zona reticularis is not basically producing enough androgens, then it's directly affecting the level of sex hormones in both male and female. So again, it's really important to do so. Now coming to the end, we're gonna kind of again quickly look at the adrenal medulla, which is the inner portion of this portion right here, the one that's shown in kind of purplish color. That is the part that is part of the nervous system. It produces two main hormones called the epinephrine and norepinephrine, or adrenaline and noradrenaline. They're going to create our fight or flight response, which is the same thing as the sympathetic nervous system. And their goal is to increase your heart rate, increase your blood pressure, slow down your digestive process, cause vasoconstriction, and increase your blood glucose. And again, all of these are done with the goal of you having enough resources to deal with a fight and flight situation. And then as soon as the issue is dealt with, then the level of the hormone decreases and your heart rate, blood pressure, vasoconstriction, everything goes back to the normal. Now, in terms of the gonads, again, I'm not going to go into a lot of details. This is discussed in terms of the reproductive system later on. But in males, I just want to kind of talk about that the testes, which are, again, the male reproductive organ, produces the main sex hormone called testosterone. Testosterone is under the control of LH, as we learned earlier, and they're extremely important for development of male reproductive organs, secondary sex characteristics such as like facial hair, deeper voice, muscle mass, more blood vessel, etc. And they also promote the formation of the sperm. They're not the reason for a sperm production, but they promote it. The ovaries for female are under the control of two hormones, estrogen and progesterone. Estrogen is important because it helps us release, mature the female reproductive system, as well as sorry, it helps us maintain, develop and maintain our secondary sex characteristics. That could include development of breasts, the hair in the genitalia and armpit, and again, triggering the beginning of the menstrual cycle. And it signals also uterine tube or uterine mucosa, the lining inside the uterus, to repair itself after each menstrual cycle. So as the old layer gets shed during the menstrual cycle or period, the new one gets repaired using elevated levels of estrogen. Progesterone, on the other hand, is released when your luteinizing hormone or LH is elevated. They're really important also with establishing your menstrual cycle, which again, targeting your uterus and preparing and make sure that your uterus is ready to receive a possible fertilized egg for implantation and again, development of that fetus. Progesterone is also produced by this kind of leftover structure from the ovaries called corpus luteum. So there's two resources for progesterone, both the ovary itself and then the corpus luteum that is located inside the ovary. Last thing I want to talk about briefly is the pineal gland, which is this tiny, tiny gland in the posterior aspect of your thalamus. So here's the pineal gland. And again, here's your thalamus right here. It produces a hormone called melatonin. And melatonin is really important because it controls what we call circadian rhythm, or more specifically, your sleep-wake cycle. It does target your hypothalamus. And again, it promotes you guys to basically fall asleep. So I have this picture of the level of melatonin. So level of melatonin during the day is really low. And as you get kind of close to the nighttime, it elevates significantly. It stays up. And then as the night kind of passes over and you're getting close to the day, melatonin level decreases and almost goes to zero when the daytime reaches again. And there is a saying that if your kids or yourself are using screen time right before sleep, it inhibits the production of melatonin, which means, let's say you have your phone in your bed and you kind of like wonder why you're not sleeping, is because that blue light from your TV or your phone is suppressing the amount of melatonin, which means you're not going to trigger that sleep-wake cycle. Okay, that's it for our lecture. Let me know if you guys have any questions.